Good evening, dear participants. We welcome you all to the third day of International Faculty Development Program. A gentle note to all the participants. Kindly sign in using your IFDP number followed by your name. Thank you.
So the resource person was here for testing. She's not. Oh yeah, she's coming. Yeah, she's coming. Yeah. Mr. Mohan, Madam Montag, yeah, kindly make her the co-host. Welcome, ma'am.
Yes. I see a little of the chat box and the
Yeah, you are already made. Fine. Yeah.
It's okay now?
Yes, yeah, fine, fine.
Okay. Yeah.
5 minutes is uploads, you can call anything is that I'll be there until 7 o'clock.
7:15.
No problem. Once it is start, I'll leave.
So the audience are mainly students, is it, Doctor?
No. Yeah.
Faculty.
Mostly faculty members. Yes, yeah. About 100 of them are faculty members. The rest of them are, students. Faculty members from all over India. Yeah,
Yes.
people have joined from West Bengal, Gujarat, Maharashtra. Yeah. So, and a lot of people have joined from Karnataka also.
I see.
Yeah.
Sir, in Andhra Pradesh also.
Yeah, Andhra Pradesh. Sorry, I didn't
Andhra
mention. Yes, yeah. Professor Soni, yeah, Andhra Pradesh, yeah. How can I forget the neighbor?
Yes.
From whom from whom we get water?
Oh.
So Karnataka and Andhra Pradesh. So you're our sources.
Thank you.
Jayashree ma'am, are you there?
Yes, sir.
Okay, fine. You can come on the video.
Yeah.
Yeah. Yes,
A
Miss.
pleasant welcome.
Yeah, go
Pleasant
ahead.
welcome, everyone. The topic of today's session is mental health in the family. To introduce today's resource person, I invite Dr. Jayashree Nayakan. Welcome, ma'am.
Thank you, ma'am. Good evening, everyone, and welcome to the third day of this International FTP. I take great pleasure in introducing Madam Swarna Gowri Govindaraj, the speaker of today's session. She is a counselor, soft skills and mindfulness meditation trainer. She has qualified herself in child psychology, abnormal psychology, counseling, marriage, and family therapy from San Diego University, USA, and also has done a course on the science of well-being from Yale University, USA. She has an MSc in medical microbiology from Kasturba Medical College, Manipal, India, and is also a certified batch flower therapist. She is presently working as a wellness counselor with the Department of Child Psychology in Manipal Hospital, Bengaluru. Earlier, she had worked with Shankara Nethralaya, Chennai, and St. Martha's Hospital, Bengaluru. For the past 20 years, she has been conducting training programs and workshops on self-transformation, team building, interpersonal skills, and such related topics. A very well-versed personality with a rich experience is here with us today to share her views and experience on the topic mental health in the family. So without wasting much time, I once again welcome Madam Swarna Gowri, and over to you, ma'am, for the session.
Thank you, Jayashree. Good evening to one and all. I initially want to thank Dr. John Balaya for giving me this opportunity to share my few thoughts and experiences regarding mental health in the family. I'm audible, right?
Yes, ma'am. Yeah.
So,
Ma'am, could you sit up a little bit? Yeah. Fine. Yes. Okay, fine. Yeah.
this thing is shaking.
Oh, yeah.
The camera. Yeah. Is it okay
Yeah,
now?
sure.
Empowering families and enriching lives. I think for the past 2 days, you've all been enriched about how to handle family conflicts and empower people, and especially the family in the family. So I would mainly, most of the sessions were based on when conflict arises, how do you handle the conflict? And when issues are there, how do you handle it? So it has been mainly focused on handling the problem after the problem is caused, right? So, but today I would like to give another perspective, a little different perspective of handling conflicts and family mental health in the family. But this perspective is mainly based on health and the consequences in the mind, in the brain. And what is the action? What is the action to be taken even before there is a conflict? What is the state of mind required even before the conflict arises, right? So we are going to mainly focus on the parents, siblings, children, and yes, both in the family and at the workplace. So how do you handle your own state of mind and your family members and colleagues, both at the workplace and in the family? So it's just a little different perspective. So I hope you enjoy the session. So we're looking at the same conflict, but with a different viewpoint. Okay. So what are we going to cover? Supporting children and teens through emotional challenges, spotting mental health struggles and breaking stigma, applying mental counseling techniques and understanding parental style. Yes, parental style was also covered yesterday, but let's see how much we can cover depending on the time. So what is the takeaway for the faculty? Faculty will gain tools to address mental health openly and supportively within the family context. So I would like to bring to your notice that every individual is not just a personality. We are just not the body and the mind. We are a holistic personality where we have all the 5 quotients, like the personality quotient, intellectual quotient, emotional quotient, mental quotient, and spiritual quotient. And we have to align ourselves in all the 5 quotients in order to have a holistic perception of life in relationship and in working in the workplace. So what is the state of mind required in order to have a harmonious relationship in both the places? So of course you should all know that when the mind is in order, the body is in order, and vice versa. So when the body is in order, definitely the mind is also in order. This is something we have to keep in mind because we are not independent. It is not working independently. Whatever happens in the mind is reflected in the body, and whatever happens to the body is reflected in the mind. And now research has gone to such an extent that the brain is supposed to be the gut is supposed to be the second brain. So whatever we are feeding our body is directly going to reflect the mind and the brain. So it is very important to know what is the diet required in order to have a alert, balanced state of mind, because it is definitely going to, as it has been proved, excess of cholesterol, excess of sugars can directly increase the sugar content and activate the brain to such an extent that the child or the person cannot, be stable in their work or in their life. So what is the balanced diet that is required in order to keep the mind alert and the body and mind alert? So a lot of research work has gone, and they have stated that a balanced diet is rich with pulses, cereals, millets, nuts, fruits, and vegetables. And why? Because it contains all the nutrients, it contains all the minerals, vitamins, minerals, proteins, carbohydrates, fats, everything in the right proportion. Now, if this Mediterranean diet can keep the body and mind alert, vigilant, active, then that is the right diet for the brain. Now, there are other things like people are, consume. For example, if you have gone for a festival, if you've gone for a wedding, or if you've gone for some, gatherings, a party or something like that, and people indulge themselves to have excess of sweets or excess of fried food or, things like alcohol, things like that. Now, the moment you take these, it is going to directly affect the brain. Right? So either you have a feeling of dullness or you can't sleep that night, indigestion. So that is the reason they say that the gut is the second brain, because it's going to directly affect the brain. Yes, there is a lot of work in this where they have even found out what is the bacteria that is living inside the gut in order to give a healthy brain. Yes, that apart. So diet that increases mental health is very important. And along with this, physical exercise, yes, we must see that all our clients and patients are having good physical exercise. It has to be a part of their daily routine. Why? Because it improves the blood circulation, it improves the alertness of the brain, it improves the functioning of all the organs. So it has to become a part of everyday life routine. Yes, breathing exercise, of course, we are all breathing naturally, but when we are breathing with attention, giving our full attention and breathing, it has a deeper effect, meaning to say the oxygen content in the body increases, and it increases to the brain also. So periodically, that is what we mean by rest. So in a workplace where people are constantly glued to the work or to the computers, and they have no time or no gap in their work pattern, it is important for them to just sit back in their places and give an attention to their breath. The moment you give attention to the breath, the number of thoughts coming also decreases, and you're able to rejuvenate the energy level. So periodically, if you can give at least 2 to 3 minutes of attention to your breath and sit back, then your mind gets rejuvenated, and your brain increases the oxygen content and the capacity to continue your work pattern. Along with this, sleep, yes, we all know sleep is very, very important. If we don't have good sleep, it is going to reflect the next day in our work and in our interaction with each other. Yes, there is a lot of research even in this angle, and they have stated that at least 6 to 7 hours of sleep is a must. And that the pattern of sleep has to be consistent. Meaning, if you're sleeping at 10, stick to 10 o'clock, or you're sleeping at 11, stick to 11 o'clock, and at least 6 to 7 hours of deep sleep is very good. Why? Because it improves there's a lot of work that goes on in the brain when a person is sleeping. Meaning to say, there is a lot of detoxification, there's a lot of protein synthesis, a lot of hormones which are produced. Along with the liver, that there is a lot of detoxification happening in the brain also. So sleep is a very important phenomena, and one cannot compromise on sleep. Okay, so because it is going to, with just a question of time, it is going to reflect on all sorts of ailments in the body. Apart from that, emotional and mental equilibrium, that is what we are going to focus mainly now. So what are the prerequisites that are required for the mind and for the brain in order to have a good, healthy relationship, whether it is in the family or in the... So health means just not the body, and just not the mind. It has to be a holistic well-being, both body and mind. Okay. So coming to the family as such, what are influences? I would like to take the children at first. So when the child is born, or even at the pregnancy stage, what are the influences on the parent, on the mother, and how it is affecting the child, right? So what are influences, and how is it affecting the mental health of the child? So who are all the factors that affect the child? The parents, the siblings, the relatives, the pets, even dogs, and whatever the pets are, can affect the child's health. Yes, as they grow older, the teachers, school and friends, all that. And further on, it is social media like the television, cell phone, internet, etc. Now, how does this influence the child? It is the energies. The energies that are created around the child has a direct effect on the child. But I'm sure by now you all know that everything in the universe is energy, right? So even for me to speak to you and for you to understand, it is being transmitted through vibrations, right? So everything is vibrations in and around us, right? So it is very important what is the vibrations that you are creating as a parent for the benefit of the child. So yes, it has been experimentally proved that it has to be harmonious vibrations of love and affection, patience and tolerance. So the more the person and the mother is caring and doing a regular exercises, eating the right food, the more healthier the child is. Yes, she should not get emotionally disturbed when she is pregnant. Right. So apart from that, what are the influences of the siblings when the baby is born, and the atmosphere that is created? There is a person who's called a science biologist who has brought out a theory called epigenetics. It's called Bruce Lipton. He has experimented and shown that epigenetics, meaning to say 50% of the genes are expressed from the genetic material which comes in the DNA, right? And the other 50% of the genes are expressed depending upon the atmosphere we are creating around the child. Okay, so the genes are constantly getting on and off. So if there is a conflict between the parents, then it'll have a negative effect on the child. If there is a depression, if there is trauma, if there is low vibrations around the child, it is going to affect the child's DNA itself. So it is so important to have the right atmosphere in the development of a child. So directly, indirectly, we have teachers, schools, and friends also affecting the child. Social media, for sure, it has which we are going to talk in detail later on. So as children grow older, what is the function of the parents? The function of the parents is to teach them different skills. Now, what happens when you are asking a child to get involved in the household activities? For the child, it's just a constant fun. The child does not know what is right, what is wrong. It'll just do what the parents are telling or what the parents want them to do. So if parents are able to teach certain skills for the child, so what happens is all the energy of the child is directed in a positive direction. So things like cleanliness, hygiene, domestic skills, like, just even, dusting the house or cleaning the vessels or, placing them in the right place. Even small things, the child can put attention and start enjoying it like a game. For the child, it is fun, right? So domestic skills, if they are constantly being exposed, social skills, manners and values, and behavioral skills like coping with emotions and behavioral management. Okay, so a lot, constantly reminding the child, guiding the child, and helping the child to realize what is right, what is wrong, and with a lot of patience, care, and concern. That is what is important, not demanding, commanding on the child. Because if you are using aggressive behavior, then the child will think that is the way of interaction, and that is what the child is going to learn. So it is very important that the parents are calmly and positively, with a positive outlook, constantly repeating what has to be done and what should not be done. So trust and honesty develops only when the parents come in line with the child's thinking. Okay, and help the child to open up at every point of time. So we're going to talk about it still more detail, how to develop trust and honesty in the child and parent. And time management skills. See, all this can happen, all the skills can be taught mainly by walking the talk. So parents cannot be just talking and expecting the child to do it unless they themselves are doing it. So I do have parents coming and telling me, I'm constantly telling my child, but my child is not doing it. So I tell them, don't expect anything. You just keep doing it. And somewhere during their life, it'll get inculcated in them. So it is very important that the parents are walking the talk and not completely, demanding and commanding the children. So that has a very positive impact on the child's mind. So how do you engage the child? So, so we are giving you a perspective of, how to develop children harmoniously, such that the conflicts and emotional aspect is not activated. So what is it that is required for the parents to be dealing with children is engaging, supporting, and loving, especially the young ones before and the teenage ones. So spending quality time by doing things what the child enjoys, not what the parent wants, but the child enjoys. It could be indoor and outdoor activities. Disciplining with a positive parenting and with a lot of patience. As I said, constantly guiding and helping the child to be moving in the right direction, to be optimistic in life and in relationship. So it doesn't matter if the child is a little naughty. It doesn't matter if the child is a little, impulsive or not listening. So constantly by telling the child or guiding the child, it is. So that means to say the parents must have an optimistic outlook in life. So it doesn't matter. You can take it as patience, testing your own patience or developing your own patience. So constantly guiding is very important, especially in the younger days. So pointing out, prompting, and being firm. Meaning to say, if the child is, being firm means instead of getting disturbed, we just have to be firm. Meaning you have to sleep at 9 o'clock, you have to sleep at 9 o'clock. So, being firm. So that is very important. And informing and teaching and repeating with practice. Why? Because children's neural connectivity has to be formed. So the more you repeat, you constantly repeat your whatever you want to tell the child, the neural connectivity gets stronger and stronger in the brain. So it is important for the parents to have a lot of patience and constantly repeat till it gets consolidated in the brain. So the other thing is consistency in chores, meaning you do once and you don't do it at all, telling the child, that it's not important, I will do it or something like that, then it will lose the link. So especially by doing the household chores. So it is important for us to be doing it repeatedly so that it gets imbibed in the child. The choices that the child makes, it is important to discuss it out with the child. So if you're going to make this as a choice, what are the pros and cons? What is the consequences? If you're going to take another choice, what are the consequences? So instead of saying do's and don'ts, it is important for them to point out or discuss about what are the choices, and if they take that choice, what is going to be the consequences. So by making the child understand the choices that it is making, then it will be more responsible and can understand. Please remember, the child's brain is still developing. So it is important for us to, think it out through and through for the child to understand. Yes, respect, appreciate, show affection, because that is more powerful. Respecting the child, appreciating the child, showing affection, love and compassion, because that is constantly practiced, then you'll notice that the child thinks that is the way of life, and it'll also start mimicking the same patterns, right? So you can't expect respect from the child if you're not giving respect, right? So you can't expect the child to appreciate any other sibling or any other person if you are not showing appreciation. So children are very, very observant, and they are very smart, they are very clever, they are very sharp, because their mind is not distracted, the mind is not clouded by other issues or other problems, so they just absorb. Like Maria Montessori says, that the brain of a child is like a blotting paper. It just absorbs everything, whether it is positive or negative, it can just absorb everything. So you have to do the filters such that the child is not being exposed to negative impulses much. So share your wisdom and insights without being critical, especially with older children. So sharing your insights, like, if you're going into the past and telling about your childhood, the parents are talking about their childhood, their problems, their ups and downs. It has to be made just like, a simple affair. No, you can't put it into the life of the child and say, see, we took such hardship that, so you have to also be taking hardship. No. Or we had such a tough life, and then you must be prepared to have a tough life. No. Please don't be critical about such things. So then the child will say, that is your problem, it's not my problem, and everything is comfortable for me, why should I take hardship? So we should take it very lightly and just say, yes, we had a tough time, and don't impose that onto the child or think that it is the right way. No. We don't need to compare the child to either the sibling or to their friends or anything like that for a child to learn, because this is going to break relationship. Comparing always demotivates a child, because every child has something unique in it. Yes, there are positives and negatives. All that we have to do is nurture the positives and work on their negatives, but never compare the child to another sibling or to another a cousin or a friend or anything like that. Why? Because you're going to remove the motivation and curiosity and learning capacity in the child. It'll go into a shell. Okay, so we don't need to use reward and punishment. See, this is something that parents have to be very careful. You come in the first 5 rank, and I'm going to take you for a trip, or I'm going to buy you something. Reward. If you are going to use reward and in the aspect of either behavior or in their education, you please remember that is the mindset you are creating. And if that is the mindset that the child is always looking for the reward in order to perform a particular task, then as they grow older, they will always look forward to the reward. And if they don't get the reward, they get frustrated, because that is the mindset you are creating. And later on, when they are working, they are in the jobs, then you notice that they have to be recognized, they have to be rewarded, they have to be climbing the ladder, because that is the mindset you have created in their childhood. So please, you want to reward them, go ahead and reward them, but don't link it to either behavior or to their education. Keep that completely aside, keep that completely in a different compartment. You just help them, motivate them in order to do well in their tasks. Punishment, the same thing happens even if you're using punishment. If you're using punishment, whatever capacities they have, okay, they may not be good in their studies, but they may be good in their sports, they may be good in their crafts or the painting or music. But if you're going to use punishment in order to discipline the child, then whatever capacities they have, even that starts shrinking. So it is not important to give any punishment, but talk it out with the child. Talk out the difference, meaning the pros and cons and the consequences of what their actions or their behavior. So there are parents who come and tell me that this child is very hyperactive, and I can't make him sit down. He's constantly moving around. So behavioral issues, ADHD and things like that. So if they have behavioral issues, then there is experimentally proved that if you give pets to the child, or even if you direct that energy in a positive direction, like putting them into sports and games and activities like music and drama, their focus will get pinned down, meaning they will enjoy what they are doing, they will learn what they are doing, and therefore the mind will be able to settle in one place. So if the mind is able to get settled in one place, and there is a constant learning and understanding, then that is the mindset you are creating. And if that is the mindset you are creating in what the child is interested, it could be it could be dance, it could be music, it could be sports, anything. So if there the mind is set and it is understanding understanding and learning, then it puts the same mindset into its education also. So, and in its behavior. So it calms down because there is no more energy for it to be, hyperactive. So because all the energy goes in its hobbies and activities, and therefore the child is more responsible and more, stable. The same thing for learning issues. If the child has certain learning issues, make the subject interesting by practical demonstration, explaining in different ways, making the child understand. Sometimes one way or the second way or the third way, sometimes even 4 to 5 methods of doing the same thing. Then the child will get something or the other. Repeat hands-on activities and develop curiosity by making it fun. See, if at all, if we have a flashback into our childhood and see, why did I like English, or why did I like science? Why did I like mathematics? You will notice that the teacher who taught us those subjects loved their subject. So if the teacher loves the subject, then she will be able to explain it in so many ways so that the child will learn. Similarly, if the parent and the teachers can help the child to, in different ways of learning, then you notice the child will develop a liking. More so in this generation where they need hands-on activities. So learning can be made interesting by having hands-on activities. And then when there is attention, without any pressure, the attention is there, then they will enjoy the subject and enjoy the activity. So then learning becomes a joy. So these are some pointers that we can use for young children all the way up to their teens and up to their adolescence also. And how do we treat people of a higher age? The important requirement in a good positive relationship, especially with older children. Please remember, all this is very why? Because we have moved from the physical development and into the emotional development, and now the present younger generation, there is the mental development, right? So it is important for us to see how their mental energy is getting activated or getting depleted also. Like all these electronic gadgets can deplete the mental energy, right? So children have become very, very sensitive. So when children are so sensitive, we have to be very careful on how we deal with them, how we treat them, what are the words we use, and what is the atmosphere we are creating for the child. I mean, for the adolescent, right? So what is the most important thing in order to develop, harmonious relationship is freedom of expression. Let the child from its young age express its feelings. Yes, I made a mistake. Yes, I beat him up. Yes, I had a fight with my friend. Let him express it. But don't be judgmental and don't conclude, oh my God, this boy is always going to be fighting with everyone. No, right? So hold everything lightly. It's not going to turn out that way. There is some amount of immaturity, and that immaturity is going to become, the child will become mature. But in that particular situation, you have to discuss. So what happens is, what is this action that you have taken, and why is it, what is the effect of that action? Could you have done it in a different way? And what is the other way that you could have done it? So by constantly asking questions, you will make him think in different ways. As parents, we should not give them the answer, but we should make the child think about it in different ways, so that the brain is already getting tuned in those particular direction, and not, we're not spoon feeding the child, right? So in a crisis or in a conflict, the child is able to make a decision. Okay, this didn't work, let me do this. This didn't work, let me do something else, right? So if from the childhood you are able to make this this communication and respect and like freedom of expression in the young age, even when they grow older, whether a girl or a boy, they will be able to express their feelings, because they know that the parents can understand them and they're not judging them or concluding them, right? So that is very important. Trust is by talking it out, discussing the pros and cons of the choices. Okay, I'm going to be away. I'm going for a party with my friend. I will not be back by 11. Okay, fine. If it is a boy, we are okay. But if it's a girl, we always say you have to be careful. Yes, talk it out with the girl and see what are the pros and cons. Okay, if you're going to be at 11, how are you going to come back? Are you going to be safe? Go on asking questions so that the child or the adolescent knows what it's going to face at that point of time. So if we can discuss how safe are you, yes, children are very tricky. They can mislead us also, and take us for a ride also sometimes. But still, it is important for us to discuss and say the pros and cons, so that they are aware of it and not be judgmental and not be over enthusiastic about their safety or anything like that. We have to talk it out. Sensitivity and respect. Please remember, children are very, very sensitive. As I told you, the brain development is at the highest peak in the present generation, and they're very sensitive. Every word that we speak are weighed, and therefore it can be misinterpreted in many ways. So please be very careful and see that your whatever the parents are talking is understood in the right way. So for that, we have to talk it out, right? Respect the child's feeling. Sometimes they are emotionally disturbed. We don't allow them to go or anything like that. They are emotionally disturbed. And that disturbance, or they may have a conflict with their friends or with their lecturers or teachers, and they may have a disturbance. mental disturbance, then in that case, respect their feelings. Don't brush it aside and think it is a mood swing, or anything. Is just no. You have to respect their feelings and give them the space to process those feelings. Foster each other's potentials by working on their drawbacks. Yes. Foster their potentials, the positives and the negatives. We have to encourage them and see that they work on their negatives. Concern and care for each other in spite of the difference in opinion. So the environment we create can affect the child. As each child is unique, we have to nurture their potentials, recognize their potentials and nurture them such that they feel empowered and not neglected, right? But don't compare them. Okay, the other most important challenges that teens are facing is they have a lot of challenges in their regular life itself. Apart from the family problems, they also have their own personal problems. They have physical challenges. They are very particular about how they look because the me is getting stronger in them, how they look, how the friends are accepting them, whether they are, accepting or not accepting, whether there is bullying going on or any, impressions that they're being created among their peers. All that is affecting their physical as well as mental health. Hormonal changes, yes, we all know there's a lot of hormonal changes happening, and that also affects their appearance, how they look, how they grow, and their complexions and things like that. So that is another challenge that they are facing. Emotional challenges, they could be facing depression, anxiety, fear, fear, anger, fear of rejection, and things like that in their surroundings. So that is another thing. Parents have to be aware that all these are things that the adolescent is going through. Mental challenges, it could be inferiority complex, performance pressure, pressures from the teachers, professors, and parents. That's another challenge. So, they're constantly trying to work, trying to prove their point, trying to get an identity in their surrounding, trying to make themselves, recognized and heard. So that identity issues are there. It doesn't matter in what activity, whether it is sports or studies or anything like that. They want to prove themselves in some manner or the other. So as parents, we have to encourage so that they get empowered. And once, even if it is an activity like games or music, once they feel empowered and they are confident in what they are doing, then they have a lot of energy. And that is the same energy they will put in their studies or in their performance or in their behavior. So we have to nurture their qualities, their positive qualities. Social media, yes, that is something, it is inevitable in the present generation. Facebook, Instagram, WhatsApp, etc. But the funny part is exposure to all this is inevitable. But what is the consequences of the brain? Yes, a lot of research work is done, and they have found out that the child matures faster, hormonal changes are faster, and there is a constant growth which is supposed to happen in their 20s is going to happen in their teens. And they found out that they grow older fast. So in fact, the social media is not only making them entertaining or having fun, but it is having a negative impact on their overall well-being. That is a very sad state. So that is where parents have to be, from the childhood itself, put a limit for exposure to all these gadgets. So as parents, how do we handle our own self? That is important. So do we respond or do we react? And so what is the consequences in response and in reaction? Reaction can result in a negative consequence, as it is an expression of our emotions or our conditioning. So we have our own conditioning, we have our own drawbacks, our beliefs, our likes, dislikes, past knowledge or experience. Like, for example, if a child comes to you and that child has been telling lies in the past, And every time the child comes or the adolescent comes to you to speak it out or to discuss with you, you have this in the background. Oh, he could be telling lies, or he is a lazy boy, or he's bound to forget something, So this is something that we have to be very careful, because if that is what you have in the parents have in their mind, that is going to reflect automatically into the child's mind, right? So slowly the child is going to move away from expressing its feelings. So please be aware of your reactions such that you are not fostering your past experience and past knowledge. Why? Because if it becomes positive, meaning if you're aware of your reactions, and if you are overcoming and not thinking in that direction, then you have a very calm and harmonious vibration around you, which is going to help in the foster in the relationship. So it is important that we are aware of our reactions rather than to react immediately. Anger, or with the past knowledge about the child or past behavior of the child, immediately you think about it, and that immediately takes over into the present situation. So as we are caught in that energy of the emotion, then that means it is your ego that is getting expressed. So if our egos are activated, then the child's ego will also get activated, right? So it is very important to handle our own reactions by being aware. Can we look at life afresh at every point of time, as it is totally new moment, and it helps the mind to be very clear in order to handle the situations. So even if you know that your child is very, very dominating or behaving negatively or telling lies, even if we know that, can we look afresh? Because this point of time, it is a totally new time, new point of time, a new situation. So when we look afresh, so what happens? Be aware of your reaction and look afresh. And then what happens? Then your relationship gets closer. Otherwise, the bond will slowly drift, right? So that is the energy coming out of you. It'll be harmonious and well, and the learning capacity is there. So what is the contribution of the parents? Parents have to be calm, supportive, understanding, and listening. Connecting, guiding, questioning, communicating without any motive in the mind, as I just gave you an example. Then emotional support, sensitive to their feelings. Yes, you have to constantly being appreciating them, showing your praises, showing your affection, motivating them by discussing on how better they can do, or how, what other means and techniques they can use in order to bring about, to flower in their own potentials, to increase their confidence, discuss on the different options that they can take, identify their potentials and encourage them, help them to work out on their negatives by stating your own opinion. Now, what is that the parents should not be doing? They should not be enforcing or influencing, because what works for them may not work for the child. Please remember, every child is unique. Every person is unique. And that doesn't mean what works for you will work for them. Yes, you can point out your point of view. You can point out different points of view, but then you cannot enforce it. And don't be influential. Meaning, putting out your point of view. Like, suppose there is an uncle or an aunt whom you don't like. That doesn't mean, the child won't like. But you can always warn the person, saying, so you have to be a little careful and don't get too, excited with the other person. Things like that. So you can warn the child, but not be over influential on the child. So compare and complain, but compare or complain, but instead of comparing and complaining, we have to discuss the consequences of the actions they take. Listening without judging, analyzing, label, or concluding. Why we should not be concluding? Because we are all learning. Every instance, every day, every point of time, there is a constant learning, either in the positive or a negative direction. So please do not conclude or label the child. Even labeling the child is not right, because we may be wrong. So that is something we should not be doing. Judging, analyzing, labeling, or concluding. Do not focus on the grades, but on the learning and knowing the subject. So if the grades are low, what is it that we have to do? We have to help the child to get a better grade and making them understand the subject. So all that we have to do is constantly helping the child in order to learn the subject better. So whether it's maths or science or English, if we can constantly put it in different ways for the child to understand, then the child will start liking the subject. To assure them that they are there with them in their journey of life. See, how parents behave with the children in their early years of life, all the way till adolescence, is very important, because this is what they carry for the rest of their life, and this is what is shaping their mind, their brain, and their behavior. So more and more of guidance, more and more of listening and learning, and together, harmoniously we are treating each other, then you notice that children become more and more a friend than drifting away from the parents. So at times we have to leave them alone in order to in order to process their feelings. Sometimes we have to keep a distance, especially when they are disturbed mentally, anger, irritations, anything like mistakes or reactions. We have to keep a distance till they process their feelings, and then they are in a position to talk it out. Then only we can talk it out. So we should not disturb them, because they get more disturbed. To manage their own conflict in their own minds by awareness, but we can help them to manage their own disturbance by being aware of it, being aware of their own reactions to that particular situation. To be honest with oneself and with others all the time, reminding ourselves that it is a learning phase for all and a passing phase also. Please remember, nothing is going to be permanent, right? So by constantly helping each other, the particular situation can be overcome, and we can also help them. And also remember that that is not a permanent state of affair. They are going that it is going to pass, and things are going to get better. Not to take anything seriously, but discuss, clarify, and iron out the differences immediately, and not to harbor in the mind. This is very important, not to hold anything in the mind, either the parents or the children. The energies that we create for ourselves and around us are very important. It has to be harmonious, friendly, and openness in the environment. Okay, now how do parents manage, or even adolescents and adults, how do they manage their own emotions? I just want to make a small point here. Emotional management and emotional intelligence. Please remember, emotional management means managing your own emotions, and emotional intelligence means having that intelligence in order to recognize others' emotions. So am I sensitive enough to see that my child doesn't want to be disturbed? Or am I sensitive enough to see that he or she is emotionally disturbed, so I should not be interfering? So emotional intelligence is being sensitive to the other person's emotions. It could be anything like, fear, anger, irritation, worry, or anything like that. So, but what happens if you are not sensitive to either the child's emotion, or to your own emotions, or to your partner's emotions? What happens? See, like for example, I would like to tell you that a child had a fear of exams, and it was constantly not whenever there is an exam, it was not going for the exam. And it used the child, even when it was in 10th and 11th grade, it used to have all sorts of stories. My stomach is paining, my head is aching, I didn't sleep in the last night. It had all these stories and didn't want to go for the exam. So this was constantly happening. Every exam he used to try and escape. Then when I talked it out with him and I spoke to him, then I came to know that he had fear for exams, exam fear. So what happens when a person is pushed or stage fear, exam fear, or even fear of darkness, fear of the unknown, fear of strangers. When we push them in order to face the situation, just saying, nothing will happen, come on, you have to face it, how long can you go on living like this? No, it is going to cripple the mind, decrease the learning capacity of the brain. Let's see, what happens is when they have the emotion, there's a place in the brain called amygdala. Amygdala gets activated. When amygdala gets activated because of the fear, because of the anger or anything like that, then what happens? The learning capacity goes and the child goes into a blank. And that is the reason children are not able to, perform in their exam. They go into a blank state. So it cripples the mind, it distorts perception of reality, affects soundness of judgment, destroys sensitivity, shrinks the senses, causes anxiety and unhappiness, reinforces the ego and obstructs the learning. So all this is the effect on the brain and the body. In so much so that in the present generation, there are a lot of IIT students and children and and people who are working in the IT department having heart attacks. Why? Because this constant stress or constant anger, constant fear is going to affect the body. And these are called psychosomatic diseases, right? So they have palpitations, they have pain in the chest, but then this cannot be identified by any of the tests. Why? Because the emotions are in and out, unless there is a complete block in the heart or a complete block in the body, any part of the body. Till then, they are not able to identify what is happening. So please don't take it lightly. If they have any fears or any emotional issues, they have to be treated. And how do we treat them? That is by being aware of their own emotions. We can give them medicines, but that is short-lived. We can give them antidepressant and anti-anxiety, all those things, but that is very short-lived. Again, if the child or the person starts thinking, then the block gets more and more stronger. And the expression is like, for example, when you have an exam, before an interview, there are people who start vomiting, there are people who start going to the toilet frequently, or even people who have giddiness and things like that. Why? Because it is the fear, it is tension, it is anxiety that is acting on the body, and that in turn gets expressed in various ways. So it is important for the person to stop thinking and instead process their feelings with awareness. Be aware, observe, notice what is happening inside your own body, and breathe in and breathe out. So when you give full attention to what is happening inside, automatically the feeling subsides and you're able to root out the block. Now, I would like to bring to your notice another lady called Candice Perth. So Dr. Candice Perth who was working on the HIV patients at that time when it was started. HIV was rampant in the world. So she was working with the HIV patients on their brain and their immunity and their body, and she came to be known as the mother of psychoneuroimmunology, the goddess of neuroscience, as she had published about more than 250 research articles on mind, body, medicine, dementia, and pain, etc. She coined the term psychosomatic wellness, and instead of psychosomatic illness, she was the first one who coined the term psychosomatic wellness. And she stated that the body is not a solid structure, it is a soup of energy. How we think, how we feel, how we believe, accordingly we are going to get expressed on the body. It is a river of intellectual energy which is constantly renewing itself. Meaning to say, it turns around 500 billion cells a day. 98% of the cells are getting recycled. The stomach lining is recycled every 5 days. The skin cells are cycled every month. Skeletal cells are recycled every 3 months. Meaning to say, there is a constant change in the very structure of our cells and in our body. And so it is so important for us, even mentally, to be constantly looking afresh. Look afresh at every point of time. Don't harbor the past experiences and past memories of the past. Okay, so every emotion or thought triggers a neuropeptide. What happens if you have an emotion like anger, fear, worry, anxiety? So the moment you start thinking, there is a neuropeptide, that is a protein chain that is produced in the brain, and that in turn acts on every part of the body, like pituitary and the glands of the body and organs of the body. So it is affecting. That is the reason I said, if you have fear, or fear of exam, fear of interviews, or fear of any fear of the heights or something like that, what exactly is happening is it is producing a protein or a peptide which acts on every part of the body. And that is why you have palpitations, you have stomach issues, you have vomiting, you have giddiness, and things like that. All cells of the immune system are producing the neuropeptide chain, and therefore it is going to affect the immune system also. Like, for example, the moment you think I'm thirsty, I want water. There is a neuropeptide called the angiotensin 2 that is produced in the brain, in the pituitary, and in the kidneys simultaneously, immediately. That is how fast the brain works, how fast thought works on the body. So then you notice that there correspondingly you take water and you drink, and then the effect is there, and you calm down the whole body. So when we truly say, I love you, and the positive hormones like dopamine, serotonin, oxytocin, endorphin, or the feel-good hormones are produced by the brain, heart, and immune system. But when you say, I hate you, or when we are under stress, or when we are under any of the emotion, the cortisol or the stress hormones are released, not only in the brain and the pituitary, but it's also in all the glands of the body and the immune system. And that is why you have a reaction in the whole body. So every cell in the body has a memory, and it gets stronger by repeating it. Suppose you think your child is a dull boy, or he has a very lazy boy. So the more you think about it, the more you are consolidating that thought, right? And it is getting expressed on the child also. So we have to be very careful how we are looking at our siblings or our children. There's another person called Dr. Joe Dispenza who said that change has to be brought from inside and not by thinking. So, like, for example, I get disturbed very fast. So I say I should not get disturbed. So it is not by thinking of the opposite, we cannot bring a change. The change can be brought about when we are disturbed. We have to be aware of our disturbance. That is by self-awareness or by meditation. That is when you can bring a change in your mind or a body. By thinking of the opposite, you cannot bring a change. It'll just be parked aside or bottled up, and some fine day it is going to come out, right? So change can only be brought about by being aware of your own reactions or your emotions. Bruce Harold Ripton was the other person, as I told you, of epigenetics. He's an American developmental biologist who stated that only 50% of the genes are being expressed, whereas the other 50% of the genes are expressed by the environment we create around the child or in the family. So if there is a constant conflict happening between the parents, then that will have a negative effect on the child. Meaning to say, the child does not know what is it that you are discussing, but the child only knows that it feels insecure, it has fear, it feels that he or she is going to lose one of the parents, and that love and affection, all those factors is what plays on the child. But the child won't know why the conflict is happening. So it goes into depression, performance effects, behavioral effect is there, and the child is gone into fear. And sometimes it can get totally closed, and you cannot make it active again. So it is very important to see that conflicts are, handled and ironed out immediately and not carried over day after day after day. So how can we bring about a change in order to have a healthy mind and a healthy body? Can relationship be a mirror in knowing oneself? Meaning, for an effective relationship in the family or the workplace, can we develop these skills? And what are these skills? The art of listening, the art of observing, art of learning, art of letting go, and assertiveness and self-awareness. What is art of listening? can be listened to the other, whether it is your husband, wife, or the child, or anyone in the family. Can we listen to the other without any reaction, without any labeling, and analyzing or concluding about what you're listening? So in case you have a reaction, please observe, be aware of your reaction. So can there be a total listening and understanding? Yes, you may not agree with the other person, but at least during the time of communication, can we just listen? And afterwards, of course, you can express your opinion. I agree or I don't agree. But in that process, can there be a total listening? Because, for example, when children are not listened to, slowly the relationship also, drifts. The children are very sensitive, and they know when you are listening and when you're not listening, right? So can you give your full attention and understand the child? And yes, after that, you can voice your opinion. The art of observing, the best example I can give you is how a child of 5 and 6 year old lives in the family. It is constantly observing everything, learning everything, absorbing everything, understanding everything. But there is no filter between positive and negative. It absorbs everything, both the positive and the negative. So, but that observation is so keen that even, there is nothing else going on in the psychological mind. And that is why that observation is 100%. And that 100% observation, it is understanding and learning. So can we as adults have nothing in our mind, but our senses are very sharp and we are also observing? For that, we have to be living totally in the moment. So when we are living in the moment without living in the mind, there is a difference between living in the mind and living in the moment. When you're living in the moment, you are living with your senses and not through the mind. But if you're living through the mind, you always have the past memory and past knowledge operating in the present situation, right? Art of learning, can we have a mind which is always open and learning from everyone? Whether you're agreeing or disagreeing is not the point, but can we learn their point of view and then, of course, drop it? Like, for example, elderly people at home, you may not agree with all that they say, but at least can we listen and understand what they are saying? And then, of course, if there is any sense to you, take it, otherwise drop it. You don't have to carry it in your mind such that, when you don't agree with them. So you just drop it. So such that your mind is clean and fresh, and you don't have to be harboring those thoughts in your mind. So that is learning, where if there is anything that you can learn, take it. Otherwise, just drop it. Art of letting go, that is the meaning of letting go. So can you just not think on those lines further on? So when you stop thinking on those lines, when you don't agree, then you're letting go, and then you're not getting disturbed. Assertiveness and self-awareness. Assertiveness means being aware of your reaction and being factual in your outlook, meaning to say, not to bring the past into the present, but being factual in your outlook, meaning, how do I solve this problem? So it's not who is causing the problem, but how do I solve the problem? Assertiveness means standing for focusing on the problem and not the personalities. So for this, there's a lot of self-awareness that is required, meaning such that you're not carried away by your own thoughts and feelings. So lastly, I would like to say, why are people getting, what happens to the mind if it is constantly seeking entertainment? So what happens to the mind? Of course, we know that it becomes restless, attention deficit, impulsiveness, low tolerance, lack of joy and happiness, lack of attention, and it is never satisfied. Meaning to say, the moment it achieves the target, it wants something else. It wants something. This is the quality of the brain, of the mind. So the more that people are exposed to all the electronic gadgets, the more the impulses are created and the more the nervous system is activated. And the more it is activated, you cannot make it quiet. And that is why they have sleep problems, they have relationship problems, they have, emotional problems. Why? Because they're not able to handle their own thought process. Their excessive thinking is happening. and not, either they're not able to handle their thought process or their sleep or anything. Why? Because you're constantly exposed to change. So that is going to create a nervous system which is always getting activated. So what is the result? Children are not able to give attention. People are not able to perform in their workplace. People are not able to give attention to their relationships, not understand the other, because they move off. Then the mind moves off. Let me think of something else. So that is the reason we encourage lesser the gadget time and more of outdoor activities, more of hobbies, more of skill development, more of talent development. So the more you are exposed to the talents and hobbies and interests of your skills that you want to develop, then there is lesser impulses going to the brain, and you're able to handle your give your attention, and in that process you're learning. So the more the attention, the more you are productive. The lesser the attention, the lesser the productivity, and lesser the learning also. So getting caught in the mind, which is constantly getting activated by gadgets, it is that is something we have to be very careful. And this, with olders, you have to talk it out and not just say do's and don'ts. Okay. So we have to talk. So what is it that we have to develop both for adults and children is curiosity in life. See, basically everything becomes monotonous, whether it is a lady in the family, or whether it is a housewife, or whether it is a person going to the workplace constantly, or even children going to the school or college constantly. Everything becomes monotonous. Why? Because you're looking at it through the mind. But if you look at it at every point of time as a learning phase, then you will develop curiosity and develop skills in order to improve yourself. So it is very important not to look at life through the mind, but through the eyes. So the body and mind will be alert, listening, understanding without concluding. Senses are sharp, living in the present, to be humble and gentle, and in a state of not knowing. So I would like you to ask yourself, suppose you ask yourself saying, I don't know. What is the state of mind when you say, I don't know? The moment you say, I don't know, then there is a state of emptiness. And in that state of emptiness, there is a lot of alertness. And that is where learning happens. So this is the method that Socrates used. And that is how he developed, that is how he became very famous, because this is a beautiful technique when you are approaching life in a state of not knowing. And then you have new thoughts, new insights, and new ways of looking at the same problem. To be factual and solving the problem as it arises. And then the mind has a lot of energy. Okay, this just to finish, I think yesterday we had the speaker has covered these four or five methods of parenting: authoritative, authoritarian, passive, uninvolved parents, and helicopter parents. So we know we have been exposed to all that. I mean, all the books and textbooks give the same thing, but that doesn't mean that parents are using these in a compartment wise. No, it could be blending with each other. These characters may overlap each other, and they get expressed in different situations, in different scenarios. But to me, I feel none of this is effective. But if you can be more respecting each other, loving each other, guiding each other, helping each other to improve in every quality, every walk of life, and being a friend to the child. Yes, talking it out with the child, through and through, of all the choices they make, all the kind of problems that they are facing, to iron it out immediately. That relationship is much more effective than any of these roles. Okay, so I would like to skip all this and Yeah. So finally, spotting mental health struggles in the family. I'm just going to run through it because I'm sure all of you know already most of the points. Spotting mental health issues even before the actual damage is caused to the brain. So how do you identify? Treating physical, the first thing is we have to take it equally, meaning the physical health is and mental health equally. Nothing, mental health is equally important as physical health. See, this is something we overlook. We usually brush it aside, right? So it is not so any longer because people are very sensitive, and a little disturbance in the mind can have a drastic effect on the body and mind, right? So we have to take mental health and equally in par with physical health. So for that, we need to have an open conversation, educating each other, expelling all myth and misconceptions, having a good support system, both in the family and community or among professions, among the family members, and also have a therapy or a counseling counseling sessions, and immediately try to work on it. Prioritize self-care practices like having exercise, mindfulness living. Now, what is mindfulness living? Like, for example, you may be you may be brushing your teeth, but when you're brushing your teeth, you may be thinking of something that happened in the past or something that you have to do in the future, but instead you're not actually giving attention to the brushing of the teeth, right? So it is important to be aware that you have slipped into the mind and come back and give attention to what you're doing. So each time you practice like this, you notice that the number of thoughts gets lesser and your attention starts flowering, meaning your attention starts getting stronger. You engaging in learning and mind activities like with age, or even people who are so involved in their work, they forget to have to give rest to their mind. So it is important to have activities like music, learning an instrument, or having some puzzles, or having some sports and hobbies, such that the mind is rested and you are doing something which is more enjoyable. So hobbies are supposed to give you more energy and good health to the brain. Asking questions on how they're doing regularly, seek professional help as early as one can. Like, people have mood swings, people have depression, people don't want to mix with other members of the family or have any social activities. So when you observe all this, please see that they are taken to a counselor or a professional help. Observe symptoms like increase in sensitivity, irritation, anger, unusual behaviors like throwing things, snapping at people, not able to focus on what they're doing. Such behavior is seen, you notice that there's something wrong with the individual. And if you can take the person and give him medical help or counseling help, it will be of great help before the damage is caused to the brain. Decline in personal care, changes in sleep or appetite. So there could be lack of sleep, or there could be lack of appetite, or they could be neglecting their personal care. So these are all certain pointers to say something is disturbing their mind and they need help. So what are the other consequences? There are these stigmas, like, public stigma, self-stigma, structural stigmas. Public stigma is what the public has created. Stigmas are something which prevents, some people are going to the counselor, they'll say, you must be crazy, or, you don't have depression. Why do you want to go to a counselor? Or you're making fun of him. I didn't know that you were such a weak person that you need help. So these are public stigmas which can interfere with the person having wanting to have help. So don't ignore it or brush it aside. Please see that the person, even if it is crazy, it doesn't matter, that they are talking it out with the concerned medical authority. Using slang languages or labels, is not appropriate. Meaning, you say, don't be crazy, don't be silly, things like that. You don't brush it aside. So self-stigma is people may put it on themselves and say, having a low self-esteem, anxiety, depression, and they feel it is a complex to go and ask for help. So having that complex, they don't go for help for their mental issues. So such things, they themselves are putting on to themselves. Like, they don't want to go to a counselor because it is below their dignity, or people may think otherwise, or family may have a wrong opinion and things like that. But one thing you have to remember, that all help is always going to help them to live a better life than to go into a shell. Structural stigma, yes, there must be more awareness in the society. Things have to become more normalized. People have to take it as a part of day-to-day help and requirement that is as important as a physical good health. Just like physical health is important, even mental health is important. So that stigma has to be pushed aside. So how do we combat the stigma? By education, by awareness in the family members, by educating children and in the college, understanding in the family, challenging stereotypes, and brushing it aside, being supportive and helping them to recover, policy changes, media representation, all this has to be, or if you have direct action, you can take direct action, that would be the great thing. So all this is a must in order to drive away all these stigmas that people have. Now, just to run through this, I would like to just point out, just give me 2 minutes. What are the techniques? There are a lot of techniques in order to handle mental issues, but the most important ones are cognitive behavioral therapy, where you are becoming aware. As I mentioned before, you are aware of your own thoughts, reactions, and feelings. And once you are aware, not through the mind, but by giving attention, by observing, by feeling, you're feeling your reactions, then you notice that energy is rooted out, like for fear, anger, worry. So by giving your full attention and feeling that anger, feeling that depression, feeling that anxiety, you are diminishing. But by thinking, you're going to increase the velocity of that emotion. Okay, so thinking is not going to solve the problem, but giving attention and awareness is going to solve the problem and diminishing the reactions or the emotions. So that is cognitive behavioral therapy, which everyone can learn and everyone can do it. Fact checking, yes, don't get carried away. Like, for example, if a boss or your teacher or the professor calls you, you may have your own imagination. Oh my God, what did I think? What did I do wrong? What did I make? Where did I make a mistake? Things like that. No, don't get carried away. As long as you feel you're in the right direction, you have to just go fact check. Go to your boss, go to your teacher, go to your lecturer. It may be a very simple thing like, did you bring your book? Did you finish this task or something like that? Right? So don't slip into positive or negative thinking before you fact check the actual situation. Okay. So why? Because every time you slip into thinking, you're going to activate your anxiety or your emotions and things like that. So exposure therapy, this is a very beautiful therapy which I have worked it out on adults and children. Meaning, whatever the individual is having fear or anxiety about, it could be, fear of darkness, fear of heights, fear of unknown things, and fear of interviews, fear of exams. Instead of exposing the person to the situation, you expose the person in his mind. Meaning, you are like, for example, you are talking about fear of heights. If a person has fear of heights, instead of going to a high building and exposing the individual, instead, in the given in his house or in the clinic, you make him expose, think about that he is going to the first floor, second floor, and as he goes to the first floor, see his reaction. There is a reaction in the body and mind. Okay, because the thinking brings about the reaction in the body. And then stop thinking and process. Process means give attention and be aware of the feeling of the reactions, the emotions that are happening inside the individual. So as you are doing this, you find that finally you go one step, 1 level and 2 levels and 4 levels, and then there is no reaction in the body. Then you can take the individual to the place, to a 2-story building or a 3-story building, and expose them. And when they are exposed, actually seeing the heights, and again you process in the sense, be aware of your reactions, then it is completely rooted out, and that is how they overcome. So we have done this with children. We have exposed them, like, they have fear of cockroach, fear of caterpillars and things like that. We have done this, and they are able to hold the caterpillar and the cockroaches in their hands. So it is a very beautiful technique, and it works very well. Yes, problem solving, equip the individual with the strategies by making them think in different ways. This is very good for children who are having problems, or even adults who are having financial problems, relationship problems. How do we handle behavioral problems in children or adults? How do you handle it? So make them think of, in the given situation, what are the ways you can handle it. Please don't give answers. As counselors, we are not supposed to give answers, because our answer may not coincide with their situation, right? So if they think it out, if this works or another way, what other ways can they think it out? So if they can think out different ways, this is called critical thinking and problem solving techniques, then they will be able to handle it. This doesn't work, another technique, things like that. So make them think it out, and we should not give them answers. That is problem solving skill techniques. And then psychosomatic therapy is a free association, meaning make the person talk freely. Everything, whether it is past or whether what is disturbing him, childhood trauma or abuse or mistreatment or workplace difficulties, problems with the colleagues or problems with the boss, make them continuously speak it out by constantly asking questions. The more you ask questions, the more the person is able to give it out, and the more you'll be able to help the individual. So that is called free association. Dream interpretation. Yes, sometimes dreams can also be a pointers to help the individual. So he has depression, he has fear of this, fear of that, that can also help. So allowing them to, asking questions about their dreams can also help. Humanitarian or ethical therapy, this is focused on inherent potentials of the individual. Like, for example, you make the person, empower the person by making him do what he loves to do. Okay, so if it dance, music, or even physical activity or sports, just make them go through, join all such activities such that they feel empowered. And then they start self-acceptance, self-worthy. They see themselves, worthy of, and this improves their talent and their love for life, and gives more fulfillment in their life. So active listening, yes, we've spoken about that, how it's more a therapeutic scenario. And the more you listen without any judgment, the more you are connecting with the individual, and that helps the person to, talk it out. Client-centered therapy is also something on the same lines, providing support, empathy, and the environment for self-discovery, as we spoke about it before. Make them feel more empowered. Okay, so it could be physical or moral or even work scenario. So they need cooperation, coordination, whether in their work or at home. They need help. So the more any person in the family can give help and support, such that the person can come out of their problems, it can be this therapy can be used. Dialectic behavior is same as cognitive behavioral therapy, where you're focusing on the feelings and emotions and reactions by awareness. Yes, they could be the other things like ERP, the exposure response, the same as what we spoke about, exposing them to the process what is it that is disturbing their mind and body and processing. Mindfulness based technique, as I said, constantly observing that you're not slipping into the mind, but you're in the present moment and giving attention to what you do at this point of time. Why? Because you're not slipping into the mind, and the mind is not getting energized, right? So the more you conserve the mental energy, the more healthier you are. So it is to be, it has to be attention and then use the mind, but not mind using the mind. There is a difference between attention and using the mind. Yes, sir.
Yeah, probably
Yes.
you can have your closing statement so that we can take at least 1 or 2 questions, because your presentations are very interesting. Yeah, probably.
Yes. So ultimately, there are a number of counseling techniques, and I'm sure you will be exposed to all these techniques in your syllabus or in your education. And yes, I'm done. Thank you. Thank you all.
Very comprehensive in the presentation. Very, very, very energetic and very inspiring. You spoke non-stop.
Yes,
I appreciate your energy.
Because I love the subject.
Very comprehensive. It's very, very comprehensive, and definitely it's a new perspective. So how to promote mental wellness? Yeah, before we get into the mental problems and conflicts, like very interesting. Probably we take
request to send the PPTs. Excellent, well-structured program was there. So I would like to have PPTs so that we can go through it.
I think it's recorded, right, sir?
Yeah, it's recorded. It's recorded. Yeah.
PPTs. PPTs were very excellent. That's what I
So they want the PPT.
Yeah, really, it is a wonderful non-stop. Everything was very crystal clear. No chance has given for raising the question. Everything covered. Excellent, sir. Excellent, madam.
So he's a senior. When he's talking, he's a senior professor, ma'am, and he has been attending our programs very regularly. Like,
okay. Nice.
So, all right,
John,
maybe we
sir,
take
one question from my end.
Yes, go ahead. Divya,
yes, please.
I was just thinking about you. Yes, Why Divya is not coming on live? Yeah, go ahead. You can turn on your video if you don't mind.
No, sir, I'm in a restricted
All right,
area.
no problem.
Sorry, tomorrow probably I will. Ma'am, under the topic of holistic development of personality, there were shortcuts of verbiage is provided, which is out of my knowledge. Can I please know that, like, PQ, IQ, I am aware, and EQ, I am aware. What is PQ, MQ, and SQ, ma'am?
Personality quotient, intellectual quotient, emotional quotient, mental quotient, and spiritual quotient. Okay.
Intellectual, emotional, mental, and
spiritual quotient.
Spiritual. Okay, ma'am. Thank you. Thank you so much, ma'am. Thank you, Johnson.
In fact, last year we had participants, for your knowledge. In fact, last year we had an offline session with Ma'am Swarna Gowri in Mysore, in her own Manipal hospitals. So therefore, we thought of inviting her to share her resources for larger number of audience. Yes, Krishiba.
Thank you, ma'am. Thank you for the excellent session. Thank you for sharing your insights, scientific evidence, and strategies to enhance our life. Thank you, ma'am. Now, to propose vote of thanks, I now invite Shyam Kumar.
Yeah. Am I audible, sir?
Yes, you are.
Yeah. Health is wealth, and a happy home is the heart of well-being. Good evening to everyone gathered here. On behalf of the organizing committee, it is my honor and pleasure to extend a warm and a sincere vote of thanks for today's inspiring International Faculty Development Program on the theme, The Wellness Home, Pathway to a Healthy Family Living. First and foremost, I express our deep gratitude to our distinguished resource person, Ms. Swarna Gowri Govindaraj, Counsellor, Soft Skill and a Mindful Meditation Trainer, Wellness Counselor, Department of Clinical Psychology, Manipal Hospital, Mysore. Thank you, ma'am, for your enlightening session. As the saying goes, it takes a village to raise a child. This session began with the thought, when the mind is in order, the body is in order, and vice versa. which set the tone for the discussion. The session on empowering families, enriching lives, mental health in the family was both insightful and meaningful. It showed how balancing different aspects for our well-being helps build a strong and healthy relationships. A major focus was on our children and how their mental health depends on how parents guide and support them. The session highlighted that even a small, thoughtful interaction between a parent and the children can have a lasting positive effect. Thank you, ma'am, for sharing such a valuable insight about the child development and knowledge from this session. Will help us to create a supportive environment at work, at home, allowing us to face the challenges with a care and understanding. I also extended sincere thanks to our respected management, faculty members, and organizing team for their support in making the online session possible. A special words of appreciation goes to our participant faculties, scholars, and learners from across the region for active presence and engagement on a virtual platform. With that, we wrap up the session filled with the gratitude, enthusiasm, ready to transform this learning into action and spread the positivity in both our personal and professional journey. Thank you, ma'am.
Thank you.
Okay, yes, yeah. Thank you very much, ma'am.
Mr. John.
Yes,
Eladia.
yeah.
Thank
Thank you
you
very
very much.
hold on, yeah. Participants, I think there was some problem with the link. That
Yes.
link will be posted in the WhatsApp group, like so you can give your assessment as well as feedback, and the link will be sent in the WhatsApp group. Like I see even today, some of the participants have not joined the WhatsApp group. Participants, please join the WhatsApp group so that from now onwards, all communications will be sent only through the WhatsApp group. Thank you. So thank you so much, ma'am.
Thank you,
Yeah,
sir.
and I'll keep in touch with you.
Yes.
Thank you.
you.
Thank you, ma'am. Thank you, sir.
Did you take picture? Yes, Dr. Mystery, yeah. You have something to tell me? Kindly unmute your mic, yes. Kindly unmute your mic.
Sir.
Yes, yeah. How are you today?
Yes, sir, fine.
Fine, okay, all right, yeah.
Okay, sir. Thank you, sir.
Yeah,
nice session.
Nice. Yeah, it was a very nice session, yes, yeah.
Nice, sir.
Okay, all
right. Okay, thank you, sir.
Thank you. Good night, yeah. So, Krishiba, shall we leave?
Thank you, sir.
All. Thank you.